Just ahead on American Black Journal, Obamacare is here, and we'll tell you about the efforts in Detroit to make sure everyone has access to quality, affordable health insurance. Also ahead, aspiring entrepreneurs are learning how to make their dreams come true. We'll tell you about ProsperUS Detroit, which is helping to create minority-owned businesses in Detroit neighborhoods. That's all coming up next.
Eric wants to know.
What does DTE Energy do to make Michigan a better place?
Rodney can tell you.
We do a lot, like youth education and employment programs. We fund over 500 jobs for youth all across the state. Many are neighborhood improvement projects just like this.
It's incredible.
Wow, that is fantastic. So this is like a paint by number, this whole thing, right? Communities are such great places, aren't they?
They sure are.
I love the siding. Measure once, cut twice, right? DTE Energy. Know your own power.
When I grow up,
I want to be an architectural engineer.
a registered nurse,
in the law enforcement,
a computer scientist,
a successful person.
Give Michigan's children the chance to aim high with quality early education.
Welcome to American Black Journal. I'm Stephen Henderson. It's estimated that 790,000 people in Michigan do not have health insurance, and the majority of those uninsured people are Detroiters. The Affordable Care Act, often referred to as ObamaCare, provides access to affordable, quality health insurance for all Americans. The open enrollment period is underway and lasts until March 31st. So joining me now to talk about this major effort to reform health care are Vernice Anthony, who's the director of the Department of Health and Wellness Promotion, Lucille Smith, who's Executive Director of the Voices of Detroit Initiative, and Ifeanyi Johnson, Executive Director of Project Healthy Living. Welcome to American Black Journal.
Thank you.
So this has been a very long journey. We first started talking about this when the president was campaigning for office, and we're now in year 5 of his presidency, and it's finally happening.
Right. Well, just starting out for all three of us, we've been in this business for a very, very long time.
Right. You've probably been working this way before that, right?
It's really been a dream of ours. You know, universal access, everybody to have health care insurance. We have been really pushing that as advocates and providers. So to see that signing of that bill was a great day for us.
Right.
But now the challenge is before us.
Right. Well, and let's be honest. I mean, they opened the exchanges about a couple weeks ago, and we got some glitches. And more importantly, it seems to me, there are people who I think still don't quite understand what this is or how it affects them.
Well, I think one of the things to keep in mind as far as the glitches go is that when this was originally designed, it was designed for maybe about 10 of the states to choose to use the healthcare.gov website.
Sure.
And for whatever
you have a
reason,
lot more.
You have something like 36, so that's like over 70% of the country trying to get onto one website, which was really designed for a much smaller.
And it was designed for the states that were not going to set up their own exchanges. And you've still got an awful lot of states saying they're just not going to do it.
And the states that did set up are really not having much difficulty getting people online.
Right.
So
it took us a while.
Yeah.
Especially for the passage of the Medicaid expansion to participate, and that would start April 1st. It's been delayed until that time.
Yeah.
But the marketplace started October 1st. We have been out enrolling individuals. Well, not exactly enrolling because we're having that difficult time for them to get through the entire process.
Sure.
But as the days go on, it's become a lot easier. And Vody has as we're called in the community, has a lead navigator who is willing to come out and speak to groups. She's willing to work with individuals who are interested. One of the improvements that they made very recently is that to prevent scams and other things, because there are a lot of concern about giving out personal information, is that you have to contact a organization or an agency for them to work with you.
Yeah, right. They can't contact.
You can't go out door to door.
Right.
You can give out literature, but you can't do enrollment.
Right.
Yeah, one of the points that I want to stress is that it's just a glitch.
Right.
It's been blown up as if there's no, health care because people can't get online.
Right.
We will work through this. It may take a little time, and there are other ways to enroll other than getting on healthcare.gov, and there is still time. So this is a tremendous opportunity to get people educated, informed. People can begin to understand what they're eligible for. As you said, people have a lot of questions. And those questions almost have to be answered uniquely.
Right, because
based on your own
everybody's
unique situation.
sure.
And because of organizations like Voices of Detroit and others that are right here in our community, where there are experts that can talk to people, so that when the website is up, it'll be easy going.
It'll be
so
easier.
this is not time lost, and people should not assume, well, that didn't work.
It's not time to panic, right?
It's not time to panic.
Right.
And healthcare does work. This is a tremendous advantage in terms of healthcare coverage and access.
Sure, and we had problems with when we introduced Medicare Part D, the prescription program. I can remember that didn't work all that well initially. So and now that's seamless, right?
Well, I'll tell you, my biggest nightmare, is that people won't enroll. There won't be enough, because we've worked really hard to do this.
Right.
We know how many people are eligible.
Right.
And to me, what would be worse
is
for us not to be able to get the numbers in Detroit.
Yeah.
Exactly.
Where we know the need is so great.
And so one of the criticisms of the bill that we ended up with for healthcare reform is that it doesn't necessarily insure everybody. But that's actually not true in places like Detroit. I mean, when you look at the population that we have between the exchanges and the Medicaid expansion, we ought to be pretty close to being able to give everybody access, right?
We are close, but it will not cover quite everyone at this point in time.
Right.
But there's still clinics out there that will accept people. Our community health centers that are partners with Voices of Detroit Initiative will accept people and charge them based on their ability to pay. There are free clinics that participate with us who are still out there, so it's not as though there'll be a gap in services for those individuals.
Right.
They'll be available, and at the community health centers, they can they can help them determine whether or not they're eligible for the marketplace and what kind of insurance. And in the process, there will be a period of time between when the Medicaid expansion kicks in and when the marketplace. So you might be eligible under the marketplace, and then you can switch over.
And then you'd have to switch over
to the Medicaid expansion, which means you are probably not paying anything at that point.
Right. Yeah, go ahead.
And there's several options under healthcare.gov. One of the things I would stress is that people should still go onto the website, because there are services that they can get to, even if they don't go through the application, where they can see what kinds of prices there are for some of the insurance policies.
Right.
Where they can get some information about the services that will be available and what they'll need to have in order to complete an application. All that's up there online, and you can get that right from the home page.
Yeah.
Actually, just to test things out, there is an 800 number, 24-hour. I called that number, and I actually talked to a live person who answered my specific question. And that number is 1-800-318-2596. So, and they actually answered the phone. This is a federal number.
Right.
Okay.
I was going to say, how did you do that in the last 2 weeks? They're not supposed to be working, right?
They answered my question. So it's the website that's not working.
That's not working.
Not the program that's not working. And that's people need to understand the difference. But I wanted to re-stress something that Lucille just said. For people in Detroit, we have to be sure there's a safety net of providers. An insurance card doesn't always assure you that there's going to be somebody available to take care of you or willing to accept you. And that would be the federally qualified health centers. That would be the free clinics. That would be the kinds of things that Ifeteo's group does. We really have to pay attention to what providers are going to be available when everybody has coverage. And primary care providers, for example.
Because this will expand the demand for coverage, and
we certainly hope that it expands the demand for primary care.
Right, and we don't have we are not producing primary care physicians in the number that we need to, and we certainly are not directing them toward urban areas like
Exactly.
Detroit in the number that we need.
Exactly.
We certainly need a lot more. And we're finding, especially among our young people of color, that we aren't producing enough people who are going into the medical field,
Sure.
especially in the area of primary care, internal medicine,
Right.
general practitioners.
Right. One of the things that the president has talked about and some leaders in Congress is the importance of getting young people to sign up for coverage.
And that's where the savings is going to come.
And that's where
from,
this. That's
you have
right.
to spread all of
That's
this
right.
out,
It's got
you
it.
know.
You can't create a pool of older, sicker people and not have the lower risk people in there. I would imagine that challenge is even tougher in places like Detroit.
Yeah, that would be very difficult. In some communities, the parents have kept their kids on even though they were in college. Now they're really glad. So the kids have always had coverage.
Right.
So they're accustomed to, I got to have insurance.
I have to have insurance.
But in our population, they have not had insurance. And there have been many young people that have grown up where their parents didn't have insurance.
Right.
So, and they go to the emergency room. So they don't see that as a need because they're not sick right now.
Right.
So we will have a tremendous educational challenge and follow up to be sure that our young people get enrolled.
And that could take, that could take a generation really to change that
It's
sort of.
a change in behavior.
Yeah, right.
Because they're used to getting their care in the emergency room when they're really, really sick.
Right.
And as soon as that episode is over with, they go back and they don't go to a primary care doctor.
Right.
So what we're trying to do is change a culture in terms of preventive care, making sure in the ACA has a lot of preventive care that there has to be provided. So the focus is now on preventive care and treatment, and that's going to be important for this insurance to be successful across the country.
The one other
It's important to remember that one visit to the emergency room could really cover the cost of your insurance for
the whole year. Sure.
Exactly, and the fact that prescriptions are covered. I really have to make that has been a huge problem.
Sure.
In people getting adequate care. If you go to the emergency room, you're diabetic or you have high blood pressure, if you don't get your prescriptions filled, you're sure to be back.
You come back,
But
right.
people have not had access to pay for their prescriptions. And for chronic diseases, that's absolutely essential. So that's covered.
And may I just
in
say
these plans.
one
Sure.
important thing. If you aren't sure if the group that you're working with is certified to take your personal information, ask them for a certificate. Everyone who's been certified through the federal government actually has a certificate that they should carry with them at all times to say that they have been
that they're allowed to
and
help
that they're
you.
not going to use your personal information for anything other than helping you get
I would imagine, and we've got about a minute left, I would imagine that there is some fear among people about the idea of going through the process, the personal information that you're giving up, and just the idea that it's different, right?
It'll
new.
be very, very different. I wanted to mention before we close, there's one really good website, consumersforhealthcare.org, that's very user-friendly, can answer a lot of questions.
Can answer questions.
Can answer a lot of questions.
Yeah.
In fact, that's what Voices of Detroit actually works with that organization.
Yeah.
So that's just a very helpful website that people can go to.
Okay. Well,
and we have a
go ahead.
telephone number for Cynthia McCoy Carter, who is our lead navigator and certified, that you can call her and ask questions or come in and see her. She can make an appointment for you or come out and talk to your group. It's 313-978-2041.
Okay. All right. Well, I'm confident with you guys in charge, we'll get people signed up and onto that insurance. Thank you very much for being here.
Thank you.
Just ahead on American Black Journal, a local organization is teaching Detroiters how to start their own businesses in city neighborhoods. We'll tell you about the work of ProsperUS Detroit. That's coming up next. ProsperUS Detroit is working to empower low-income minorities and immigrants by training them to become entrepreneurs with businesses based in Detroit neighborhoods. The program provides the budding small business owners with financial resources and technical assistance. ProsperUS Detroit began 1 year ago and is a partnership between several community organizations. Here to talk about the program's successes and challenges is Kimberly Faison, who's the Director of Entrepreneurial Initiatives, along with one of the program's trainers, Shantae Dixon, who's the president of Precisely Done Enterprises. Welcome to American Black Journal.
Thank you so much for having
this program
us.
is a wonderful idea. I mean, everybody says that one of our big problems in Detroit, one of our problems related to employment is the lack of small businesses in neighborhoods.
Yes, yes. So our program is a place-based economic revitalization strategy, and we do that through entrepreneurial training, technical assistance, and micro-lending. And we find that in addition to learning about what it takes to start a business, a lot of soft skills are developed along the way that may make a person more ready for the workforce. So there are a lot of other benefits in addition to finding out if your business idea or even your home-based hobby that you use for a side income is actually a viable business idea.
It is a business, yeah.
Right,
and talk about what some of those soft skills are.
Oh, so we've got people learning how to do research, how to use data, using public speaking, and the opportunity to use the classroom as a place to vet the idea, and also perfecting their business pitch. And people are figuring out how to use even financial projections, and in some cases for the first time. And those are things that are transferable and can be used
whether
in the
you're going
workforce.
to own your own business or not, those are things you can use in a job.
Absolutely, absolutely. So we see a lot of breakthroughs in the classroom, and Shantae could probably speak a lot.
Yeah, I was going to say, you are an example, correct?
Yes.
Tell me about your business, first of all.
Well, I do management consulting. I've been in the micro enterprise development field for 14 years now, and working with individuals who are at a crossroads in their lives. Many of them are unemployed. They have been testing the job market for quite some time and cannot find viable employment. So what we do is help them to look within themselves, do a self-assessment, and see what they can bring to the marketplace. And as Kimberly shared, we help them to do that research to determine if there is a demand for what they offer. Everyone doesn't start a business. I don't think that's realistic, but I believe that everyone should be provided an opportunity to explore entrepreneurship. And some individuals go through the program and develop those soft skills, as Kimberly mentioned, learn about management, about the financial analysis, and they can come to a knowledge of if entrepreneurship is something they even have a desire to do after that.
And
so I look at that as a success.
That's an important point. It's not for everybody, right? Running a business is tough, and running a successful business is really, really tough, and not everybody is necessarily cut out for that. And just because you have a good idea doesn't mean it's necessarily a good business.
Correct. And we have a lot of people that are really good at using their hobby, and they might, test things out at their church or in their neighborhood with friends and family. And it may be good for just a little bit of income. It may not be appropriate for bricks and mortar space. And so we give people a safe place to test that out, and so that they don't invest, all of their resources, their financial resources, into something that may not be the approach that they thought was appropriate. It may not be the right approach.
That may not work,
for example, a restaurant. So many people who have a really good recipe want to start a restaurant without recognizing all of the demands. So we find that a lot of people end up using their skills for catering and to have some other specialized ways to kind of get their goods out in the marketplace without having to sign a lease and to to make investments in a building.
And have to have that support that commercial kitchen. And I mean, most restaurants, I have a lot of friends who are restaurant owners. That is a very, very demanding business, and a lot of them go under. Even the best food on the menu doesn't mean you've got a successful restaurant necessarily. Tell me about the neighborhoods where you guys are working right now.
We're in Southwest, Cody Rouge, and North and Central Woodward. We do have a desire to expand into more neighborhoods and are having conversations with neighborhood organizations to see if our program is a good fit in their neighborhoods. But we also kind of act as a convener as it relates to the place-based work. So we really want to make sure that we're able to have impact on the commercial revitalization. And we're starting to negotiate with an organization that can help us to access data and mapping to make sure that we understand what the opportunities are on commercial corridors.
Right.
But we also want to take some time to work with residents and to find out what are the goods and services that you're lacking.
Yeah.
Where's your money going?
Right, right. Demand is an important part of this equation.
Yes.
I'm wondering, those are very different areas of the city. Southwest is full of small businesses. It's hard for me to think of any businesses that I even know of in some place like the North End. What are you guys seeing in terms of the needs, the different needs in those areas?
Well, I know in the Cody Rouge area where I primarily do the training, they've done a strategic planning session and they've involved the community in that process. And some of the needs that they are seeing, just providing school uniforms, we're looking at bakeries in the neighborhoods, women, plus-size women clothing establishments. So those are some of
the things that they feel like they need, and so you're trying to match them up then with
the needs.
People who are maybe in a position to provide those things.
And that's the beauty of the ProsperUS program. They do collaborate with the community partners. Each community has different needs, and the Cody Rouge community is very active in providing those supports that the entrepreneurs are going to need. As far as identifying the viable space to be able to operate their businesses. And also provide them with other support as far as if they have any financial credit issues, they can help find the resources to help alleviate those issues as well.
Yeah. How do the participants take it when you get to the point where you have to say, this is a good idea, but it's probably not going to be a successful business?
So our hope is that they develop the skills to come to that conclusion on their own.
Decide that on their own, right?
Yes, yes. And so there are a lot of, discussions that happen both from the interview process all the way to graduation when they're actually doing a pitch of their business. But the wonderful thing about the program is they actually get one-on-one coaching with their trainer. And that is, I think, a soft reality check for people. But the idea is that they make that assessment for themselves. And when they get to the point where they have a completed business plan, then they can take it to our microlending officer to see if they can become eligible for microloans or technical assistance. And that's, that is a harsh reality sometimes, but we emphasize that we don't want people to take risks unnecessarily, or we want to mitigate those risks as much as possible.
Yeah, the lenders. That's one of the real challenges in Detroit, especially capital for small business. How have you been able to help them solve that problem?
So we just launched the microlending component of our program this year, and what we are finding is that there is a significant lead time from the time that people graduate from the program to the time that they actually are ready to put a package together that goes before the microlending committee. And we're finding that knowledge about the lending process and about putting together financial projections is very, very key. So we realize that there's a lot more education that needs to go into just the lending process. But we're really pleased with the program that we've put together and look forward to being able to reach not just graduates of our program, but existing businesses in the neighborhoods that we serve.
Right. When you started your business, did you need a loan, and how hard was it to get that?
For me, my business transitioned from the work I've done.
From the work that you were already doing.
Management. Yes, so it was just birthed from using my existing skill set and just transitioning on my own.
Which in some ways is the best way to start a business, right? It's something that you're already doing, and then you decide.
And I can share my stories with individuals because most of the time they feel that they should be able to launch right into their businesses full time. But the reality of it is that you may need to hold on and maintain your source of employment until you're able to transition.
Because a lot of, for most businesses, that first year, you're not necessarily generating enough revenue to live on, right?
Yes. Yes, it is very challenging, and we try to use again the one-on-one coaching with the trainer to talk about how to sustain yourself. And we recognize that the reality is that a lot of times people have to work while they're working on the business.
Sure.
And we try to provide supports in that area too. So a lot of the partnerships that we have and the community partners in the neighborhoods provide access to workforce.
I see.
Yes,
Very
yes.
good.
There's a lot of wraparound services that are built into the program.
Yeah. Okay. Well, this is a great piece of opportunity unfolding in Detroit. Thank you for being here.
Thank you for having us.
Absolutely. In just a couple of weeks, Detroiters will go to the polls to select a new mayor and city council. For the first time in nearly a century, voters will elect council members by districts. American Black Journal and Detroit Public TV want to help you learn about the candidates for Detroit City Council. So we've produced a series of debates that can be viewed online at myvote.org. That's MIVOTE.org. That's our program for today. Thanks for watching. We'd love to hear what you thought about today's show and get your ideas for future topics. So connect with us on Facebook and on Twitter. We'll see you next time on American Black Journal.
What does DTE Energy do to make Michigan a better place?
Rodney can tell you.
We do a lot, like youth education and employment programs. We fund over 500 jobs for youth all across the state. Many are neighborhood improvement projects just like this.
It's incredible.
Wow, that is fantastic. So this is like a paint by number, this whole thing, right? Communities are such great places, aren't they?
They sure are.
I love the siding. Measure once, cut twice, right? DTE Energy. Know your own power.
When I grow up,
I want to be an architectural engineer.
registered nurse,
The law enforcement.
a computer scientist,
A successful person.
Give Michigan's children the chance to aim high with quality early education.